Vanakkam, Namaste and welcome to Dr. Shah's clinic. My name is Dr. Shah and I'm a consultant in male infertility and sexual health. And today's awesome video we're going to discuss on how to get pregnant quickly with irregular periods. In this video, I'm also going to share with you quick tips to get pregnant quickly with irregular periods. Now, when is a patient said to have irregular periods? A patient is said to have irregular periods when she notices her cycles come once in 3 months or once in 6 months or maybe once in a year. Now, it's very important to understand here is that if you see your cycles falling consistently between 21 to 35 days, that is duration on month, that is not considered as irregular periods. Now, for most women, the cycles will fall, mostly between once in 28 days, once in 32 days, once in 34 days. But a variation where the cycles happen between 21 to up to 35 days, if your cycles fall in between those time frames, that's also considered completely normal and the cycles are considered regular. Keeping that point aside, it's important to understand that polycystic ovarian syndrome, also called PCOS, accounts for approximately 60% of the medical cases that present with irregular periods, and PCOS is one of the largest cause of irregular periods. Now, as a clinician, as an infertility specialist and as an andrologist, I've seen hundreds, maybe thousands of patients who come to me with irregular periods as a primary problem leading to infertility, and most of the time they come with a scan report stating that, oh doctor, my ovaries show a peripheral distribution of follicles, I've been diagnosed with PCOS, but my cycles are regular, yet I'm unable to conceive. Now that's something completely absurd, because a PCOS and a diagnosis of PCOS is only made if a patient has or fits into the following 3 criteria, as also called as the Rotterdam's criteria. So as per the Rotterdam's criteria, we diagnose a patient with PCOS if she has 1, irregular cycles. Point number 2, an ultrasound scan of the ovary that shows at least 8 to 10 follicles distributed along the ovarian margins or the periphery of the ovary. Point number 3, clinical or biochemical signs of elevated androgens. That means clinical signs of elevated androgens means the patient would have, a male pattern of hair distribution somewhere, beard growth, mustache growth, or facial hair, too much facial hair, or the patient can have a lot of acne. Biochemical signs means the patient may have elevated amount of androgens in the bloodstream, which we assess with blood tests. All said and done, PCOS is extremely easy to manage, relatively speaking, of course, and it's a treatable condition. Now, there are other causes of irregular periods, and other causes of irregular periods are thyroidism, hypothyroidism particularly, and elevated prolactin levels. That's also associated with irregular periods, and sometimes a condition called premature ovarian failure, which is genetic in nature, is also associated with scanty or irregular periods. Now, I would like to share some quick tips with you, to get pregnant fast or to get pregnant quickly if you're having irregular periods. And here are the following tips. Point number 1, quit smoking if you're a smoker. Point number 2, beat alcohol. Point number 3, lose body weight. Keep your BMI optimally between 19 to 24. Point number 4, try sexual intercourse every other day, because when you have irregular periods, you don't know when you're actually ovulating. So maybe, optimizing your sexual frequency where you have sexual intercourse once in an alternate day may just help you conceive. Point number 5, definitely don't get stressed out. Beat the stress. Try yoga, try some meditation, and do something that actually eases your mind and relaxes your stress and worries. And the other important point would be is you definitely need to visit a gynecologist and get a proper evaluation, because most of the time giving simple medications like oral contraceptive pills and some medications like clomiphene citrate or letrozole as prescribed by a gynecologist or your infertility specialist can in itself help you conceive naturally when you have irregular periods. So I hope you enjoyed this video on how to treat irregular periods quickly or how to get pregnant fast when you have irregular periods. Do comment, like and subscribe. Do kindly share this video with all your friends and loved ones, and I promise to make many more such videos. This is Dr. Shah, consultant in male infertility and sexual health, signing off for now. Bye-bye.